Today we're going to be discussing nuclear medicine. So this will be a brief introduction of nuclear medicine and talking about PET scans. So nuclear and molecular imaging is a little different than our traditional modalities of imaging that we utilize in radiology, such as CT and X-ray. This is a field of radiology that utilizes radiopharmaceuticals for imaging, and then it can be used to guide treatments and identify physiological processes. The biggest difference in nuclear medicine is that the emission is directly coming from the patient via the radiopharmaceutical versus the radiation from the scanner, which is what we see in CT and X-ray. So again, in this case, we're using radiopharmaceuticals, which are generally injected into the patient, and this will emit radioactivity, which is then imaged using PET scanners or other gamma scanners, etc. And this allows for detection of physiological processes. And in this picture at the bottom, you can see how the radiopharmaceutical is linked to a vehicle molecule, which might be involved in a physiological process, and eventually this can be kind of monitored. So it allows for detection of oxygen utilization, glucose metabolism specifically. This is important identification of tumors, drug delivery and uptake, blood flow, and neurotransmitter release. So nuclear imaging has a wide variety of applications, specifically in identification of physiological processes. For example, it can be used in diagnosis of myocardial blood flow, identifying and staging malignancies, and guiding therapy for different malignancies. Over here is a PET scan image, and we notice this increased area of uptake right here. So the patient was initially given FDG, which is a radiopharmaceutical we'll discuss later on, and the increased area of uptake represents tumor cells. So this can be harder to see on a CT, although PET scans allow us for good visualization and kind of correlate it with normal CT scans, so we know the areas of increased uptake. And it can be used to identify CNS conditions such as epilepsy, dementia, Parkinson's disease, sarcoidosis, bone imaging, VQ scans, and identification of pulmonary embolism. It can also be used therapeutically, for example, in treatment of bone metastases, usually in palliative care, thyroid disease such as hyperthyroidism, or targeted radioisotope treatment, or something like non-Hodgkin's lymphoma. So we're going to briefly talk about the basics of nuclear imaging and specifically focus on PET, which represents positron emission tomography. So the main idea behind nuclear imaging is that it utilizes radioactive decay. So this is an example of a chart of various radioactive decays. You might have seen this in a physics or chemistry textbook, and PET specifically utilizes positron emission. So the radiopharmaceuticals such as FDG, which is commonly utilized in PET scans, are unstable, and they tend to seek stability by disintegrating to a more stable form. So therefore, this is going to release a positron right over here and go to a more stable form. And when the positron is released, it's combined with a nearby electron, leading to annihilation, release of energy in anti-parallel directions. Now, PET scanners are really good at identifying this event, and they're able to pick up this event and compute images that we see on a PET scan. So over here is a little diagram of how PET scans work. So as we discussed earlier, FDG is one of the radiopharmaceuticals that is utilized in PET scans. It stands for fluorodeoxyglucose. This is a variant of normal glucose. So over here you have the fluorine here, which is eventually captured in the cells like normal glucose, although it can't undergo metabolism like normal glucose would. And eventually this is going to decay, and when it decays to a more stable form, it's going to release a positron, which is combined with a nearby electron, and this will lead to release in energy in anti-parallel directions, which is then picked up by the PET scans with the scintillator crystals, and eventually the photosensors will compute this image. So again, detection from a single annihilation event is known as a coincidence, and there's thousands of these occurring simultaneously, and the PET scan is able to pick this up. And this is a very complex process. It involves a lot of algorithms and timing, and the photon interaction with scintillator crystals are eventually what is used to compute the image that we see in PET scans. So here are a couple more images of a PET scan. So the image on the left is a MIP scan, which is a whole body scan. The patient received FDG, and this is kind of a 360-degree scan, so you can kind of turn it around and locate all the areas of increased uptake. It's also important to distinguish the areas of physiologically increased uptake. For example, the brain will likely have increased uptake of FDG because it utilizes large amount of glucose. So this is not concerning. It's a normal physiologically expected response. Same with the bladder. So again, it's really important to distinguish this from a pathological response. Now over here we notice increase in FDG uptake over here and the lungs and throughout the liver. So this is concerning for metastatic disease. And usually you'd kind of start off by looking at a MIP scan and then hone into the specific areas of concern, and then look at the axial views. So over here we can notice how there's increased uptake of FDG over here as well, which is correlating with the areas above the lungs. So again, this is concerning for metastatic disease. Thank you guys for watching this video, and I hope it was helpful.